Hey guys, this is going to be the latter half of your Unit 5 content. We're going to start wrapping things up talking about psychoactive drugs today and into the next video. For today's content, we're going to just talk about some properties that all psychoactive drugs have, okay, regardless of the specific type. Okay, so that's going to be our starting point, and then we're going to move into the different categories and then subtypes within those categories in the second round of notes on this content. Okay, so for the sake of making sure we're not wasting your time, let's just keep on trucking. Okay. We define any kind of psychoactive drug as a chemical substance that's going to alter some aspect of either your cognitive processes or your behavior. Okay, so whether that be your consciousness, your perception of things, your mood, okay, and then the actions themselves that you carry out. So, a lot of times, what kids think of when they hear this phrase psychoactive drugs, they think of the illegal stuff, okay, or they think of the things that are a lot more prevalent in terms of like illegal activities. So they'll think of heroin or alcohol or pot or things along those lines. But the reality is, any kind of substance that's out there that can alter your perceptory processes or your consciousness could be considered a psychoactive drug. So, for example, Advil, that's a psychoactive drug. It's technically, I believe it's ibuprofen is its generic name, right? But it alters your perception of pain. It makes it so that way you feel less inflammation and less pain messages get sent in your body. Same for Tylenol. Tylenol is a psychoactive drug. Even caffeine, what you drink in your coffee and in your energy drinks, that's a psychoactive drug. It's legal. It's the most widely used legal drug out there, but it is still important to recognize that legal drugs can be psychoactive drugs too. Okay, so just because something might be over the counter or considered to be okay, it doesn't mean that you don't still need to be really careful when it comes to ingesting those substances, okay? You can OD on Advil. Too much Advil can cause serious damage. It can give you ulcers in your stomach. There were new warning labels put on Tylenol a little while back saying too much of that could cause permanent liver damage. Okay, so there is no such thing as a fully 100% safe drug. It's just using it in moderation. That's something to keep in mind. So let's talk common properties that are prevalent in all psychoactive drugs. Okay. First and foremost, there's the biological effect. So when we're saying the biology here, what we mean is each drug has a distinct physiological impact on you, okay? It's important to recognize that how a drug impacts your body physically is not necessarily the same thing that we're referencing when we're talking about how it can influence you cognitively speaking. Okay, the entire reason why drugs can work in the first place is because the molecules in them are so tiny, they can surpass something called the blood-brain barrier. And so that's this outer covering of your brain that makes it so that way, things that could get into your bloodstream, viruses and infections and stuff can't make it through to the brain because if they can, it could absolutely be deadly. But how psychoactive drugs work is their molecules are so small that they're able to get by that blood-brain barrier, and then that's ultimately why it's able to have the effect that it does. So you guys know, for example, that I'm really big on caffeine. I need it. I've talked with you guys about my issues with getting a decent night's rest because of my kiddos, and caffeine is very much my lifeblood. I drink lots of coffee, and that has not changed since being, that doesn't change when I'm home. It doesn't change when I'm at school. Like if anything, it just gets, I develop a tolerance to an awful lot of it. Okay, so the way that that impacts me or is able to impact me biologically is because the molecules of that caffeine are so small, they make it past my blood-brain barrier and they go up to my brain. And what they do is they impact the physical functioning of my cerebral cortex and they speed it up. Okay, so that's a biological effect. Um, these drugs can influence your body in any number of ways. Okay, so you heard me talk about Advil that can influence how you perceive pain, whether it comes from your foot, your head, from a headache, anything along those lines, okay? The biological effect is going to vary from person to person, but we do know that there are some things, generally speaking, that can influence how a drug will affect you. First and foremost, your weight matters, okay? Um, how large you are depends on how much of a drug you should ingest. Okay, so for example, my kids take children and infant Tylenol and Motrin. Okay, I've talked about my son teething. You have to be very mindful of how much a child weighs when it comes to the amount of Motrin that you give to the child. So then that way there isn't something that could possibly harm them, because if they give too much, which a lot of parents can do accidentally, then that can have some very serious consequences for the child. So we know that my son falls within a very specific weight range for his Motrin that he gets when he's teething, and so we always make sure that we check that out. You're not even supposed to give Motrin to babies until they're 6 months old. So I mean, obviously they have to be a certain age. Which brings you down here to the age itself. You guys know, for example, that they have moved the legal age to buy nicotine products or vaping products to 21 because of all of the research out there that's showing the horrendous physical permanent impact that vaping is having on teens. An astronomical number of teenagers are vaping, and they're now coming to realize just how bad it is for their health. There are an awful lot of issues with people developing something called popcorn lung, which is drastic permanent lung damage that makes it very difficult for kids to breathe. And in this day and age with the coronavirus, there's a lot of question as to whether those who are recreational vapors, if you could be putting yourself at significant risk for developing even greater complications from coronavirus because of what you're doing to your lungs, since it's already such a nasty respiratory illness. Gender matters too. Women have far less muscle mass than men do. Men have more muscle mass, and so they metabolize things way faster. So that's why when you've typically, I'm not trying to stereotype here by assuming that every one of you guys have witnessed this in some way, but a lot of times when you see this stuff presented in TV, in movies and stuff like that, women have a tendency to get drunk from alcohol far faster than men do. And there is absolutely science behind that. Because a guy has more muscle mass than a woman does, women, we're just prone to have more fat in us because we need it for that whole growing a baby thing. So a guy can metabolize alcohol out of their system far faster than a woman can. And so that's why women can have a tendency to feel alcohol far more quickly. They can get drunk faster. And then ultimately that can have a greater significance on them the more and more and more that they ingest. Whether a drug's taken on a full or an empty stomach matters too. My daughter, for example, has been prone to significant issues with ear infections throughout her life. She got tubes when she was 18 months to help with the drainage issues that were always causing those problems for her. And so we became quite familiar with antibiotics through that whole process. And so every time that we would give our daughter her antibiotic treatment, and again, based off of her weight, they determined a certain amount of antibiotic she was allowed to have every 12 hours. We had to make sure that she had food in her tummy, so then that way it wouldn't cause even greater issues to her stomach, because we know too that antibiotics can kill off even the good gut bacteria that you have in your tummy that can regulate things. And so, a pretty nasty side effect for children that take antibiotics, and even some adults too, is digestive issues. Okay, so all of these things can have impact on a person when it comes to the biological factors for how a drug will work and affect you in some way. Psychological and environmental factors matter too. These are different than the biological ones, because the biological stuff is all about physical things that can influence how a drug affects you. Psychologically, what your expectations are, I'm going to tackle this guy first. Your expectations of a drug are very, very significant in terms of how they will influence you. Okay, we've discussed all the way back into Unit 1 the concept of placebo effect. The placebo of morphine, so a narcotic, something that has significant capability of altering your perception of pain and mimicking your endorphins. The placebo of morphine, the fake treatment, is half as effective as the real thing, right? So if you think you're getting a morphine drip, for example, after surgery, even if it were the placebo, it's going to make you feel less pain because you expect it to make you feel less pain. Okay. My expectations when I got an epidural with both of my children was that it would help me not feel the pain of childbirth. So because of that, I likely felt less significance with regard to the pain that I had in those moments leading up to and once I got the nerve block. If I think Advil is going to take away my headache, it's going to take away my headache. Okay, if I think my coffee is going to make me less tired, it's going to make me less tired. So, what your expectations are intimately connect to how the drug will influence you in your perceptory processes. Personality characteristics matter too. It's a sad state of affairs when I have to sit there and listen to people because they forget sometimes that they are in an academic setting. And they sometimes just don't realize that I'm a teacher and not a student, especially on Fridays when I'm standing at my door and I'm in jeans and a t-shirt because I still look like I'm in high school. But I'll hear people talk about how they can't wait to go to so-and-so's party because, they've had a terrible week and they just want to get blitzed and blah, blah, blah. Well, here's the thing, your personality characteristics matter significantly so on that, like not to mention the illegality of those behaviors. Um, but if you are somebody who is anxiety prone, who has depression, who is a more pessimistic personality type in general anyway, guys, alcohol is a depressant. It is going to make you more depressed. Okay, so while there is some research out there that maybe a small amount of alcohol can make a person feel less um, or I guess they could make you feel more uninhibited. Okay, so you feel a little bit more comfortable socially interacting with people. Let's be real. The average individual who is under the age of 21 who is drinking is binge drinking. So you ain't just sitting there going to somebody's party saying like, "Oh, I'll just have one drink." Like people are going crazy overboard on it. And so they're pushing themselves to a point where they're going to have just terribly bad reactions and responses to that alcohol. They will become more depressed. They can, in many respects, become highly aggressive, which is why you hear so many scenarios of people who are drunk. They become disorderly, they become violent, they become angry and nasty, they start fights. Okay, so those matter intimately when it comes to the personality characteristics. Okay, if you are already somebody who holds tight to those feelings, alcohol ain't going to magically make you feel better in those scenarios. And that connects in with mood too. If you're in a bad mood, all the alcohol is going to do is it's going to heighten that for you. Your experience with the drug matters too. I'm going to out myself on this one. We know that I drink a lot of caffeine. At the start of a school year, the amount of caffeine I have to ingest to get the desired effects to wake me up is a much smaller amount than what it takes for me to get the desired awake and alert feeling that I need when it's, say, February or March. Okay, I need more because I've exposed myself to it more and more and more and more and more. Okay, and so we call that tolerance. The more that you build it up, the more of it you need. Okay, you'll see this with athletes who take Advil or Tylenol for aches and pains and stuff like that. The amount of Advil that my husband needs to ingest to take away some of his knee pain, he's had 2 reconstructive knee surgeries from football. The amount he needs to take that pain away from him is a whole lot different than me. I have to take like kid amounts. That's not kidding. I'm not kidding on that one. I'm like 5'2", so I'm basically the size of like a 12-year-old kid. Setting that the drug's taken in matters too, and you heard me make reference to this with parties and stuff. This is, um, it's not something that you guys are supposed to be doing at your age because one of the things you guys are going to see in many of the articles you're going to read about drug content is y'all are causing permanent lifelong alteration to your brain makeup because of the way you guys are using these drugs recreationally and the fact that your brain is still growing and developing. And because of the settings you guys are taking these drugs in, where they're at parties, there are group dynamics that are at play. Y'all aren't sitting there, just drinking them the way that, many of us in our mid 30s are when we're at parties. Like, we're pretty cool with just having one or two and being perfectly fine. Teenagers are binge drinking in excessive amounts. The average first binge drinking experience for a teen boy is 11, and for girls, it's 13. And I mean, that's sixth and seventh grade that you're seeing those behaviors presenting themselves. And you have a 5 times higher likelihood of becoming an alcoholic when you ingest massive, copious amounts of alcohol younger and younger, which many people are doing. Okay, so the setting matters. Y'all are doing that because you're doing it at parties because you think that that's what teens are, everybody goes to parties. I'm not trying to sit here and sound like Officer Steve from the DARE program and stuff, but I am trying to point out to you guys realistic expectations for how these things are working and what that's doing to you guys in the long run for things. So drug abuse then is when recurrent drug use results in your ability to essentially function normally, whether that be academics. So we know a lot of research out there about recreational marijuana usage, how that is impacting teens in particular, who do it even minimally in a recreational sense. It's permanently altering your limbic system. Remember that part of your brain that deals with motivation, learning, memory? It makes you forget things. People who are who highly use marijuana, recreational marijuana, their IQs are different than those who don't. So when your usage gets in the way of academic functioning, social functioning, your ability to keep down a job, and it puts you into issue of legal problems or even psychological problems, because there are scenarios of drugs causing depression and anxiety, for example. That means that you are in a scenario of drug abuse, and so help definitely needs to be administered there. Okay, so factors found in drug abuse. Social and cultural norms that are favorable toward drug taking behavior. You heard me talk about this with you guys just a minute ago. It's seen as almost a rite of passage that teenagers are supposed to go to parties where there's lots of drinking and, marijuana usage and all the other kind of stuff. That's a totally cultural thing. And I've got people who I know for a fact have hosted German students when we've done our exchange programs who can back me on this. And I myself, I went to Europe when I was a senior in high school. Here's the thing, guys, you don't hear about binge drinking issues or alcohol issues in Europe to the extent that you do here. It's virtually non-existent in Germany. And that's because it's just not seen as this like forbidden taboo thing that teens are supposed to do because it's forbidden. It's perfectly normal in German culture for a 17-year-old, for example, to have a glass of beer or a glass of wine with dinner if they want to. It's a very normal thing. And so because it's normalized there isn't this feeling or sense by teens where it's like, oh, I'm not supposed to do it. Rock on. I'm going to do it a whole lot. And so you see a very, 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 very different issue with teens here who struggle infinitely more with drug abuse than you do there over in Germany. The availability and the cost of the drug matters too. Before, it was perfectly acceptable and legal for people at 18 to get cigarettes and e-cigs and vaping materials. You can't do that now. It's got to be 21. And so as a result, that influences how it is that a person can get their hands on that drug if they desire it. Role models and family members. You see this fairly frequently. Those who have family members who smoke are more likely to become smokers themselves. You can see scenarios, it has run in my own family, issues with alcoholism. If family members perceive that that is normal behavior, they themselves will operate on it. Okay, it's an awful lot of what we would call observational learning. We see others, we perceive that behavior as normal, and so we imitate it. Association with peers. If your friends are really involved in those things, then peer pressure is real. It is very, 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 very influential on you guys, again, because of that lack of frontal lobe development up here. There is a part of your brain that is so wired to how others perceive you in the frontal lobe. It is insanely active with you guys as teens, it's virtually non-reactive for us adults. So we don't really care what you guys perceive of us or what others think of us to the extent that you guys care of how others see you. And so peer pressure can be something that can have a high influence on kids, to do things that they wouldn't necessarily want to do, but they feel like they have to if they're going to, for fear of judgment, essentially. And then a sense of alienation from society as a whole. People that feel that others don't understand them and who struggle with mental disorders, a lot of times what they do is they self-medicate. There's a substantial differentiation in the number of diagnoses of mental disorders for women versus men. And a lot of that comes again down to a cultural norm piece. Guys are told essentially that you're not supposed to have emotions, like you shove those down, it's like guys don't cry. And it's more socially acceptable for women to have wider ranges of emotional expression. And so it's more okay for women to seek help, theoretically, than guys do. And so what you see an awful lot more of is you see far more drug abuse in men than you do women. And the underlying issue behind that is depression and anxiety. And simply what the men, or the boys are doing is they're self-medicating to deal with those struggles that they have. And so that's a sense of, alienation from society in general. So this is where I'm going to ask you guys to cut things off for this portion of psychoactive drugs content, because the next video is going to involve us hitting things more individually between the different types of drugs like depressants, stimulants, and hallucinogens, and then all of the different kinds of drugs that fall within those categories. Okay, so I hope you're doing well, and let me know if you got any questions, guys.